my name is Holly Gerslin-Becerra, and I work for the Texas Institute for Excellence in Mental Health at the Steve Hicks School of Social Work at the University of Texas. I'm honored to be a part of a state collaborative team for Texas Launch, and we serve as the Training, Technical Assistance, and Implementation Team. LAUNCH stands for Linking Actions for Unmet Needs in Children's Health. Project Launch is a national initiative to promote the wellness of young children from birth to 8 years of age by addressing the physical, social, emotional, cognitive, and behavioral aspects of their development. Project Launch was initiated by the Substance Abuse and Mental Health Services Administration back in 2008, and a total of 55 sites have been funded nationwide. The initial Project Launch site in Texas was actually led by Liviani Inc. in El Paso. In 2015, Texas was awarded a cooperative agreement to expand its successful strategies in 3 additional Texas communities: the Tigua Tribe in Isleta del Sur Pueblo in El Paso, Tarrant County MHMR in Fort Worth, and Family Services Association in San Antonio. The Texas Launch Project focuses on 4 core strategy areas: increasing screening and assessment in a range of child-serving settings, providing family strengthening and parent skills training, building the competencies of the early childhood workforce statewide, and implementing mental health consultation as an early childhood service.
I think one of the biggest contributions that Texas Launch made was the development of a state organization that really supported early childhood mental health. There are a number of different state agencies that play a part in the overall early childhood system and have a stake in early childhood mental health, but there was no coordinating body that really oversaw the mission and really created strategies to push it forward. And so I think that was an important thing that Texas Launch was able to do.
I believe the biggest contribution that the grant had for the state of Texas is that there was an impact on all levels. There was an impact on state activities, for the communities themselves, for the organizations that were involved in the grant, as well as individually. I feel that if you ask each of the people who were in a part of the grant, that they feel that the last 4 years was very impactful, not only in their professional life, but the work that they did in their communities.
The benefits of having a state and local collaboration with Project Launch, I think, allowed us to really think kind of at the state level and at the local level about more about early childhood system framework, to really think about what are the components that are required to really look across systems at early childhood services to address all needs of young children and families. So we appreciated that opportunity to try things at a local level, pilot things, but get guidance and direction from the state level, and then come together as part of the early learning collaboration to really hear from other state partners and what was happening with the other state partners, and then think about how what we were doing at the local level really aligned with what was happening at the state level. I think getting all of the support at that point and being able to take that back to our local coalitions, and which is also interagency and made up of people that are probably representative of a lot of the partners that are at the table at the state level, it really allowed for some pretty deep communication about what is best for young children in the state of Texas and what direction do we want to take.
I think the benefit of the state and local collaborations are that we informed each other. Sometimes that was the community informing state level, and sometimes it was state level informing community work. Also that alignment, that we had the same goals. Depending on what the strategy was, both at the state level and at the community level, we wanted it to sustain in our state and as well as in our communities. And lastly, I think it was also a great benefit of collaboration. The communities had excellent partners and worked really well with them. The early childhood wellness councils were supported by great partnerships, and also within the state level, whether it was the TLEC or the work groups, collaboration was a key piece in making sure that the grant moved forward.
So I can speak firsthand on how the community's work really garnered state level sustainability of the work groups. The Department of State Health Services and the Maternal and Child Health Unit, we are actually going to take on ownership of the Project Launch Developmental Screening Work Group. And this is because we saw the work and effort that was put into this group and the changes that have been made in the past 4 years, and really realized the importance for it to continue. And it really aligns with our mission and vision and work that we do on a daily basis. So we're really excited to continue the work and seeing everybody on a monthly basis and seeing how much more impact we can have on developmental screening in the future.
The biggest impact that Launch has had on our community, Launch has done a lot for our community. We have implemented 4 core strategies. We've implemented the developmental screenings, the family strengthening, workforce development, and mental health consultation. Developmental screenings has largely impacted the community in that we have been able to provide screenings for the children and identify possible delays very early on, and have been able to refer them for services.
The biggest impact that the Launch Project had on our my community is that in the perspective as the early learning coordinator, I got to see firsthand how once the children coming into our center, once they were here, within 2 weeks the ASQs were performed and done, and that gave us information on how what milestones the childs were meeting and stuff like that. It also helped with letting the staff know where to begin doing lessons with the children, and we also had the experience of having different trainings that pertain to the different developmental stages within the children. So it was important to kind of know where the children were at, and it helps set precedents as to where we need to move forward with our children.
Our Texas launch communities were really amazing. One of the amazing things that I think they did was really use this opportunity to build systems that could support early childhood mental health. So they brought together partnerships from all sorts of organizations who had a role to play, and they brought together families and families with important things to say, and they created systems. So they used those partnerships to enhance the services that were available, to ensure that they were connecting with each other and making the systems easier for families to navigate, and then identifying where the gaps were and figuring out how they could creatively resolve and address those gaps. So it was really the systems building that the communities did that I was just so impressed by.
We were able to establish such a long-term community system through our launch grant, through parent cafes. We partnered with Be Strong Families, and they came into our community over the first 2 years, and were able to train 108 providers in our community. We then partnered with Launch and Be Strong Families to say, how can we take it a step further? And we developed a train the trainer model, and we were the first in Texas to take it to that next step. So Be Strong Families then came back last year and trained 15 trainers in our community. And since then, that training team has been able to go on and train 88 more providers in our community. So we have about 196 people now in our community that are trained in facilitating parent cafes. And overall, we've served almost 2,000 families. And so we can see this has such a huge impact in our community that will last for many years to come.
So I think each of our programs were so unique, but there are lots of opportunities to really share and lend each other's best practices, experiences, insights. So we're going to stay connected informally, and then we're going to try to develop some formal process. And the informal way is we're going to continue to email and communicate, and hopefully, now that we've gotten an additional SAMHSA grant, share some of those resources, insights, and information with the other two cities, Fort Worth and El Paso. And then we've talked initially about, well, we're going to continue to participate in some of the work groups, like the Early Childhood Mental Health Consultation Work Group. So we're going to share training as well. We've talked about some of the training that we've done independently, and so we're hoping to share that training. Fort Worth has a wide expansion of services and resources, and our focus or our strength has been the Early Childhood Mental Health Consultation, which we hope to share with them, and they can share some of the connections they make nationally as well with us. And with regard to El Paso, we're always interested to also share some of the training, some of the experiences we've had, and to do some training possibly with them in consultation.
So the Department of State Health Services is really excited to continue working with the expansion communities that were a part of the Project Launch Grant, especially to see and keep tabs on the work that they're going to continue in the future. We're excited that Fort Worth has, the MHMR of Tarrant County has developed this Help Me Grow North Texas model, and we want to look for ways that we can partner and help expand and that to other communities in the state. We also are excited that San Antonio, they were awarded another Project Launch grant. So we're gonna hopefully continue to support them through those efforts as they expand mental health consultations to the more of a provider feel and in the hospital. And lastly, Ysleta del Sur Pueblo, we're excited because this still is one of our partners in the Native American community, and we are looking to continue that and see if there's other ways that we can reach that population.
Some of the changes that Launch has brought to our tribal community include policy changes. Tribal Council has implemented policies at the Early Learning Center that include screenings for children enrolled at the center. It also includes, as part of parental engagement, participation in the Incredible Years parent classes.
All right, so there were several ways that happened. Definitely, I think the thing that stood out the most was the amazing staff that the launch office in Austin had. Lots of support, lots of flexibility, encouragement, patience as we initiated the program. So we're very thankful to the lead staff that supported our efforts in the communities. Because of these efforts, we were able to secure other funding. There was an interest in the community in Launch and the activities and the services and the benefits, obviously, to the children in the communities, particularly around the area of health disparities. So the communities that we targeted tend to have fewer resources with regard to mental health, for example. And so Launch enabled us to be able to expand the services to those areas and reach more children, thereby at least working towards reducing those health disparities. The other thing I think that happened is, because of the success of the work and the interest in the community, we were able to secure additional community partners as well as support and funding. So we did that through a couple of ways. One is through United Way is now supporting one clinician that's doing the early childhood mental health consultation in the same communities that we were doing it for Launch. And then we received, because of the successes and the support, an additional SAMHSA grant that will go for 5 years starting August 31st, 2019. So we're very excited about that, and that effort will continue to sustain the parenting activities, the early childhood mental health consultation, the developmental screenings, and in addition to that, we're adding the integration of behavioral health and medical health with one of the public hospital systems. So we're not only sustaining the efforts that we've done, but we're actually expanding them to include another strategy.
And through the Parent Cafe model, we have created a new relationship, and that is with our faith-based community. We first talked to the Ramp Church in Fort Worth about the Parent Cafe model, and they really embraced it and said, sure, let's get it going. And so we've had several parent cafes at their church, and we've served over 200 families in parent cafes just at that one church alone. We've also been able to partner with the Ramp Church in other parenting groups, developmental groups, TBRI groups. When they were there to open the doors for their new church, we were there for the ribbon cutting. We were able to meet the mayor, and she was so impressed about the parent cafes that then she ended up attending one of our parent cafes. So that was another great relationship that blossomed from the parent cafes. We then recently partnered with the Ramp Church to even have a mental health awareness day, of which several of our staff were a part of.
I think that it's important to continue to maintain the relationships that we've established with community members and different agencies that we work with, just because I believe very much in continuity of care. Continuing to maintain those relationships with communities, agencies, and ensuring that intercollaborative dialogue is still happening for the good of the community to ensure that the families are having their needs met, families and children are having their needs met.
One of the most impactful things that really resonates and that resides well within me is that in one of our communities, such as Fort Worth, for example, they introduced parent cafes to the community. And it was met with such, I guess, applause that you have parents actually, wanting to have their own parent cafes, requesting them, or even hosting them themselves.
One of the most impactful experiences I had with Project Launch was having the opportunity to participate in one of the parent cafes. I was able to participate as a parent with my spouse, and it was interesting to find out having the parent perspective of being able to communicate with other parents and knowing that we have similar experiences or different experiences within the family culture. It was nice to know that we were able to communicate with other parents and see the different perspectives in parenting, as well as that we have, available different resources to be able to, ask for help in case we do need assistance within parenting as well.
One of the lessons I learned is that bringing change to a community, it can be challenging. You've got to be persistent and you've got to stay positive.
The biggest lesson learned in the past 4 years is that you really do need every creative mind and support at the table in order to change policy. True collaboration comes from building trust, and trust in each other, trust in the policies, trust in the systems that you're aiming to build or change. If you can foster the strengths of all of your partners involved, you can get a lot accomplished in a short amount of time.
What did Launch teach me in my professional life? Well, it taught me the importance of developmental screening. It taught me the importance of collaboration. It just taught me how to be a better professional overall, just by virtue of working with such wonderful people.
In regards to my professional life, one thing that Launch has taught me that even if you think your role may not be that significant, there are always things that are happening in the background that you may not be aware of, and your role is vital no matter how big or small it may seem.
Personally, I really loved having the collaboration with the other two communities in our state. It was really interesting to look at 3 communities that were set up quite differently. Even our host agencies were very different, the populations we were serving, the urban versus rural types of communities as well. And so it was always fun to get together and to know that we were focusing on some of the same key components, but to see how it was unfolding within our communities. And I think even as we talk about future sustainability, it's interesting. There appears to be strong sustainability with all three of the programs, but it looks quite different with each of the three programs as well. So it's always interesting to see how you can plant seeds and then see how they grow, and sometimes they grow in different fashions.
So the things I enjoyed the most about being a part of this grant is the people that I got to work with throughout the process. The individuals are very passionate about early childhood topics and are really on the ground making things move in their communities and at the state level. And it has made me more passionate, made me more excited to come to work every day, and look forward to what things come in the future.
The thing I enjoyed the most about being a part of this grant was working with such a great team, as well as meeting other team members from the communities and experiencing their enthusiasm and dedication to the work that we do.
Hi, I'm Laura Kinder.
I'm Stephanie Norton.
My name is Fred Cardenas.
Hi, my name is Julia Alvidrez.
My name is Linda Wiley.
My name is Molly Lopez.
I am Satara Lumen.
My name is Holly Gerson-Becerra.
I am Diane Ewing.
My name is Arnold Amador.
My name is Audrey Young.
My name is Claire.
My name is Jacqueline.
Hi, my name is Jose Lopez.
I am a part of Texas Launch.
So there's got, wait.
Is I was able to
Changes at the policy level.
At our university, blah, you gotta redo it.
Blooper.
Oh, take 6.
The initial project launch site. Sorry.
It's okay. No.